This segment of CoastLife is sponsored by BeeBe Healthcare.
CoastLife, we celebrate so many national days on this show. Yesterday was National Oreo Day, and guess what? Today is Hospitalist Day. A much more important day, I think, especially to celebrate a lot of our local healthcare workers. And joining us on the CoastLife couch with BeeBe Healthcare is Dr. Kristie Zangari. Welcome.
Thank you. Thank you for having me here.
Thank you so much for being here. Now, you are a hospitalist with BeeBe Healthcare. Paige was even asking kind of, what is a hospitalist?
Oh, great. So a hospitalist is a physician who specializes in hospital medicine. So generally, a hospitalist is an internal medicine physician or a family practice physician who spend the majority of their time taking care of hospitalized patients. So we will essentially care for folks in the hospital, pneumonias, urine infections, heart failure. And once they're well enough to leave the hospital, we return care to their primary care physician.
Interesting.
Interesting.
Yeah. So Hospitalist Day, can you tell us what that is, how that got started? You know, I'm assuming it's celebrating people like you.
Exactly. Back in 2018, our national organization, the Society of Hospital Medicine, thought it would be a good idea to raise awareness and to celebrate the care that we provide in the hospital. Like you mentioned, not a lot of folks understand what we do until you might be in the hospital for some reason. So it was to bring awareness, celebrate, the care we provide for patients.
So talk to us a little bit about your role as a hospitalist and with BeeBe Healthcare. If somebody is in your care, what does that look like?
Great. So I am the medical director for our hospitalist team. We are a group of 28 physicians, including advanced care practitioners, advanced care clinicians. So when a patient might present to our emergency room and it's felt they would benefit from a hospitalization, we would be called and asked to bring that patient into the hospital to provide care. We would care for them throughout their entire hospitalization and then coordinate a discharge plan, get them well, and then get them back home and transition care back to their primary care person.
This is really cool. I like learning about this because it's you don't really think, you don't want to end up obviously in the hospital. But it's interesting for when you do or when your family member does, you're knowing who's kind of behind the scenes, if you will, who's there taking care of you.
Yeah, in the beginning, first hospitalists were in the late 1990s. And unfortunately, or fortunately, I date back to about 2022 or 2002. And so I'm one of the original pioneers. And in the beginning, patients did not like it at all. Again, because they know their primary care physician, expected them to be with them in the hospital. It's become more common, and the benefits really, I think, have swayed patients to realize it's a really great way of caring for patients. It allows the primary care physicians to stay in the offices, and in this area we need.
They're needed there too.
Yeah, exactly. Need them to stay in the office to care for patients, and then we will care for their patients in the hospital. The benefit is that we have at least one physician in the hospital 24/7, every day of the year, holidays, weekends. So if you are in the hospital and your family has a question, we're a phone call away, we're down the hall. If there's an emergency or a change in your condition, someone can be right there at the bedside. It's not calling, outside of the hospital waiting for a physician to come in. There's someone there who can be there quickly.
That's awesome. And I think too, knowing that you guys are sort of responsible for that discharge plan and getting you back to, either your GP or whoever's going to be kind of taking you, that aftercare is so intimidating when they just kind of hand you a stack of papers and they're like, okay, take them home. And you're like, what? What do I do now?
Now what? So we are always working to improve that process. As folks are, more ill, the discharges are more difficult and more complicated, you know, and as time goes on, you know, the thinking is, oh, I stay in the hospital till I'm 100% well. You know, with the changing healthcare environment, you know, exactly, we get you well enough to finish caring for yourself at home.
Right.
So folks are leaving the hospital these days a little sicker. So it is very intimidating. So we try, you know, to help make that an easy transition.
You do, and it's nice to know, that there is a team at BeeBe that you can always call, can always go back to, a hospitalist like yourself that you can always go. So if someone wants to say thank you, if they want to kind of celebrate you guys today, what are some ways that they can?
Oh, well, you know, physicians, APPs love food. You know, always ready for, you know, a sweet snack. It's
a good idea.
But also, you know, we have the BeeBe Medical Foundation. We have a lot of patients who do work with the foundation and give a gift of gratitude on behalf of their hospital team.
That's a great idea.
Awesome. Well, Doctor, thank you so much for coming in and,
thank you.
Sharing with us about Hospitalist Day. I mean, a day that we didn't really know anything about at the start of this interview, but we appreciate you and all the work you do to help keep, you know, us and folks in Sussex County healthy and back on their feet should they need to stay in the hospital.
Definitely.
Great. Don't go anywhere. We do have some more CoastLife headed your way. We're going to have some more fun coming at you when we get back.